Well, one of the most impressive parts of what we've seen in this horrific tragedy in Chennai has been people coming together and corporates coming together to help one and all, whoever needs help. Preetha Reddy, the Managing Trustee of the Apollo Hospitals, joins us now. Ms. Reddy, thank you very much for speaking to us. How do you feel that this spirit of collaboration has really made a change?
You know, I think in times of disaster, everybody has to work together. And it's extremely important that, you know, we join hands. Chennai has been under like a tremendous disaster. The deluge has been literally unbearable for thousands of people. And I'm glad that the hospitals came together to help each other. We've helped, you know, rescue operations going in boats. The Navy's worked with us. The fishermen have worked with us. There have been ambulance services which have spun into action to really rescue patients from places where they need to be moved from one location to the other. And I'm glad that, you know, the extreme commitment of the doctor community, the support staff, the nurses. I mean, they haven't left the institutions for 3-4 days. They've literally lived here and worked with the patients, and I think that has been commendable. Hospitals have exchanged medicines, oxygen, ventilators from each other. Staff have seamlessly worked with other locations. Senior doctors from, you know, for example, from a competing hospital have brought patients into, you know, our hospital system. They're working side by side with, you know, with staff in Apollo. So I think the coming together has been good. The lessons have been that, you know, disaster preparedness for healthcare facilities is extremely important. I must ask you this.
We've also seen a situation where hospitals have not, for example, had ventilators which are working. Preetha, can you hear me?
The JCI accreditation helped us to be prepared for disaster, and I think that's been important.
Preetha, what I was trying to ask you is this. We've also heard stories from hospitals in Chennai where ventilators have not been functioning because electricity has been a problem. It's not been available. Patients have suffered as a result of this. Critical care units have been affected. Has this been a real crisis in Chennai?
You know, I don't think, number one, that anybody would try to do intentional, like a mistake or harm. Electricity has been there because, you know, all hospitals have been running on generators for more than 57 hours. I mean, just now, you know, some of us have got electricity connection, but that's because, you know, the substations have been submerged with water. So electricity has been a problem. Transport of oxygen has been a problem because it does come in trucks, and then, you know, the trucks have been held up.
Right.
The oxygen manufacturing facility came underwater. So I think there have been issues throughout the city for sure, and people have been working very hard to cope with it.
All right, Preetha, thank you very much for speaking to us, and thank you so much for reaching out to people in the city of Chennai. Thank you very much indeed.